Hello, we're Team Houston Fire Department and we're here to present an impact analysis of COVID-19 on EMS services. COVID-19 has had a devastating impact on the Houston community with upwards of 191,000 cases and 3,000 deaths. As we approach the third wave, it becomes increasingly important to address these challenges. Our mission was to leverage the power of data to gain data-driven insights in COVID-19's impact on community demands. We've done this through three main areas. The first in leveraging time series capabilities and understanding demographic features such as age, race, and income. The next, a call type analysis to see the effect of comorbidities and the severity of calls in EMS cases. And lastly, a geospatial analysis to understand how COVID is spread across the city. We hope our results will improve operational efficiency and, most importantly, save lives. We hope to see you at our booth. Thank you.
Every 15 minutes, a child is born with a congenital heart defect. Of those requiring surgery, 48% develop post-operative arrhythmias, a startling statistic since arrhythmias can be life-threatening and must be detected and treated. The problem is that current detection systems have an 85% false alarm rate, so physicians don't know which alarm to tend to. We find this unacceptable. Thus, we have data coming from 50 different patients spanning up to 7 days of data coming from the heart. We have an electrocardiogram signal, we have 2 blood pressure signals, and we have 1 oxygen saturation signal. We take these signals and extract morphological features in the form of images using a wavelet transform. Then we input these features into a deep learning model and classify them either as arrhythmias or as healthy events. Finally, from this deep learning model, we have a 98% accuracy and false alarm rates as low as 0.6%. Thank you so much and enjoy the showcase.
Imagine an emergency has occurred. You call 911 and the fire department dispatches an ambulance to your location. It takes 6 minutes for them to arrive. But what if the accident had been anticipated or even prevented? This is a reality Intera envisions for communities across the country. Using fire department incident data from 11 states, we sought to identify demographic features that are most related to the number of emergency incidents in a community. In order to find these features, we grouped your data by communities, which we defined as census tracts. For each census tract, we have the number of incidents per capita, as well as a variety of demographic features that describe the community within the tract. After using machine learning models such as XGBoost and Bootstrapped Lasso, we determined a rank order of the demographic features that best explain the number of incidents in a census tract. Intera can then use these features to identify ways to reduce community risk. If you'd like to learn more, please visit our booth at the D2K showcase.
Hey everyone, my name is Emmett, and I'm going to be telling you about the COVID-19 chatbot project. We're currently living through the COVID-19 pandemic. Every day, thousands of people are becoming infected with the virus in the US alone, and the healthcare system is becoming overwhelmed. The virus is known for having a number of severe symptoms that can develop in unusual ways. It is important to bring these issues up to a medical provider in a timely manner. On top of that, the number of infected people greatly outweighs the number of doctors, and this imbalance is only getting worse as the virus spreads. For many patients, visiting the doctor is out of the question due to fear of spreading the virus, but they still want a way to track their symptoms and get medical attention if needed. Telemedicine wait times can be long, however, and basic symptom surveys don't offer the personalized treatment patients are looking for. For these reasons, Smart Chatbot is here to help. We have developed a chatbot which tracks symptoms, provides up-to-date information, and can make predictions about a patient's future status with the virus. Join our virtual room to find out more.
Many companies today manage terabytes of data from various sources. This data can be used for analyzing customer behavior, training artificial intelligence models, or supporting company operations. However, large and complicated data are incredibly difficult to manage. What if a machine breaks? Or what if someone changes a setting? An analyst might try to use the data only to find out that it's been completely wrong for months. The identification of errors like this is called anomaly detection. Our dataset is from National Oil Well Varco, a world-leading provider of oil drilling equipment. It contains data collected using their Novos drilling optimization software, which manages the operation of machines on various oil rigs. Many traditional anomaly detection methods often only find obvious anomalies, such as data points that are significantly different from the rest. However, in highly complex data, the anomalies become more difficult to distinguish. For this reason, we are exploring human-in-the-loop deep neural network models that can uncover meaningful relationships within our 40 billion data points. To find out more, come visit Team NOV at the D2K Virtual Showcase.
Hi, we're Team Air Pollution, and this is an introduction to our project. For our project, we're studying NO2 or nitrogen dioxide levels in the atmosphere. This is important to study because nitrogen dioxide contributes to pollution, which can cause serious respiratory issues. Additionally, in urban areas, a main contributor of NO2 is fossil fuel burning through vehicle activities. As you can see, there's a strong relationship between nitrogen dioxide, human activity, and environmental health. So why is this important to study during the pandemic? Well, the various lockdown policies implemented around the country has led to a decrease in vehicle activity, and we want to study how this has impacted nitrogen dioxide levels in the atmosphere. This is a valuable real-world experiment. Lastly, our project is unique because we're also looking at the relationship between our tropospheric monitoring instrument or TROPOMI satellite data with the OMI satellite data, ground level air pollution, and vehicle activity to understand the link between these different factors. We look forward to meeting you and sharing our findings at the D2K showcase.
Hi everybody, we are Team CSI Houston cat-saving investigators, and today we will be presenting how predictive maintenance can help CSI Compresco make more informed decisions about repairing machines. CSI Compresco provides oil and natural gas processing services and has provided us 4 years of compressor sensor data. Our raw data has two types. Telemetry data gives us daily measurements of sensor readings from each machine unit, and work order data records every scheduled and unscheduled work order and their timelines. The question we're trying to answer here is, how can we use anomaly detection techniques to recognize abnormal behaviors that lead to unscheduled work orders? These work orders are reactive maintenance orders that oftentimes indicate a machine malfunction. Finding these anomalies can help us develop better maintenance schedules in the future. What does this mean for CSI? We can save them a whole lot of money. Our models can then take streams of data from the machines and tell us which points it thinks are off. An engineer can then look at these results and determine if the anomaly requires fixing. Thank you so much for listening, and please visit our booth for more information.
Congenital heart defects are the most common heart defects in babies, affecting over 40,000 infants each year in the United States. Infants with hypoplastic left heart syndrome are born with only half of their heart developed, have to undergo surgery, and are at high risk of cardiac arrests. Working with Texas Children's Hospital, we apply data science and machine learning techniques to collect heart signals for powerful real-time monitoring of these infants' cardiac function. These include methods like autoencoders and change point detection. What doctors may not be able to perceive, our algorithms can detect. Our techniques can generate early warning signals for cardiac events, giving doctors more time to take action and save lives. This approach enables proactive treatment for cardiac events. Come to the D2K showcase to learn more on Wednesday, December 9th. We hope to see you there.
Age-related macular degeneration, or AMD, is the leading cause of vision loss in people over 65 and impacts 11 million people in the US alone. Loss of vision in the elderly reduces quality of life and increases mortality, with negative effects ranging from physical dangers, including falls, to emotional distress, including depression. The success of any of the available treatments in reducing the rate of progression is entirely dependent on early diagnosis. Since the earlier stages of AMD have especially subtle symptoms, it is often too late to effectively treat the patient once a physician becomes aware of AMD's presence. If we can identify genes that are potentially linked to AMD, we can diagnose patients in earlier stages with less apparent symptoms to maximize the benefit of these treatments. To see how our group utilized various machine learning techniques to identify these genes, please watch our full-length presentation.
We're entering a new era of remote learning, and as COVID-19 forces school closures across the country, it's crucial that students aren't left behind, which is why our project aims to reduce academic achievement gaps. Our partner OpenStax is an education technology organization that provides schools with resources such as free online textbooks. This semester, our project objective was to leverage OpenStax data to improve outcomes in the classroom. For example, while a student's performance may decline throughout a given semester, our project seeks to identify when a student is falling behind by using techniques such as time series modeling, matrix factorization, and deep knowledge tracing. We can then create a tool that enables teachers to intervene whenever necessary, and as a result, Our project strengthens student-teacher connections, promotes educational equity, and reduces student achievement gaps. Thank you.